Welcome back. This is lesson 4 or video 4, and we ended video 3 by asking you to go and look up Carolyn Ellison and some terms, dignity of risk and duty of care. I'm going to come back to the last bullet point in this slide in a moment, but I want to skip to the next slide to help you answer those questions. So dignity of risk is a really important concept, and you'll have to know it well as you work in this field. It's based in the idea that we have a degree of dignity, that we add dignity to our lives if we take certain types of risks. And I want you to understand what we mean by dignity. If you think about your wellness in sort of 4 different areas, your spirituality, your physicality, your mental and cognitive wellness, and your emotional and social wellness, we really are talking about just one of those when we talk about safety. We're talking about your physical wellness. So what do we call those other parts of ourselves? Our emotional side, our mental side, and our spiritual side? Well, we really mean the wellness in those areas. So the safety of a person in every other way besides their physicality is what we mean by dignity, our overall wellness. So dignity is acquired in a few different ways. We'll talk about them in other modules. But there's dignity in taking certain types of risks. For example, in your life, think about what it's done for you to be going to school. It was a risky thing to go to school. It cost you money. It was a life decision that probably took you away from things like family time and your job. So there's a certain degree of risk there, but I'm guessing that you did it because you believed it would help you in those areas we just talked about in terms of your emotional welfare, your mental welfare, and potentially even kind of your spiritual and philosophical side as well. Other examples in your life might include things like skiing. You might get a great rush or thrill, a real quality of life boost by doing that activity. Or going on a date includes a number of risks. It might even include some physical risks if you're dating somebody you've never met before. And it might sound strange, but even smoking is a perfect example of an activity that people do to enhance their dignity. When we smoke not just because it might physically help us to feel a certain way or to give us pleasure, but it also is likely something that people do to help themselves with emotional things like coping or social things like talking to other people at the smoke pit. And so if we try to tell people they can't smoke, you might imagine that that becomes a big source of conflict. And the reason why is that people aren't fighting because they don't care about their health or safety. They are fighting because they care about their dignity and it matters to them. So dignity of risk simply says we have a duty to support people in taking such risks, to literally facilitate or help them to achieve such risks. But we have to remember some risks are just risky. They don't have the dignity. They have a really bad ratio. There's not really any dignity enhancement that comes from it. It's just dangerous, or it's so much more dangerous or so much more obvious that the person's going to get hurt that it's difficult to imagine. So if a person goes skydiving with a parachute, you can see that that's a fairly safe thing to do with a high yield of dignity. But if a person jumps out of that exact same airplane without a parachute, there's no dignity and there's a whole lot of risk. Another example that I've got on this slide, if somebody wants to hit themselves with a hammer, well, really, it's not really easy to see how that's going to do anything to improve their quality of life. And it almost certainly is going to cause them lasting and significant harm. So what do we do? Well, not only do we have a responsibility to help people to tackle risks that might enhance their dignity, when we do that, we also have a duty to mitigate risk or to really lessen it, to take down the level of risk so that it is not more than necessary. So we might do things like giving people information ahead of time, advising them of risks, or helping them to rehearse or giving them education. An example might be students doing fire drills in a school. Another thing we do is eliminate unneeded risk. So for example, driving into a parking lot and walking into a school is a risky thing to do. It's not really risky, but there's a little bit of risk there. And certainly it gets a lot more risky if somebody leaves ice on that path. And so it's considered to be part of our duty that we go and remove that ice because it's unnecessary to keep it there. And in some cases, we might literally say, I'm sorry, I cannot make that happen for you because there's not enough dignity and there's an almost certain outcome of harm, the high risk factor. An example of that might be a person who says they want heroin and asks us to go get it for them. Clearly, we wouldn't do that. They might say that that's going to make them feel better, but it's a very risky thing. And the risk reward is just not there. And that's why, for example, people who are getting drugs that are helping them to withdraw or to get treatment from heroin addiction, like Suboxone, are taking a version of that drug that is far less risky. It doesn't have the same degree of negative side effects. So one of the terms you came across is duty of care. And duty of care simply says there are a bunch of things we have to do. We have a legal or sometimes fiduciary duty that tells us we must take certain steps to provide for the wellness of the people we support. Those reasonable steps are things that we talked about a moment ago when we talked about neglect. For example, making sure people get their basic medical care, giving them their medicines, giving them their diet, making sure that we take people to the doctor if they are ill, that sort of thing. It included things like having shelter. It included things like helping people to have good nutrition and so forth. So those examples, those things all fit together. Let's go back to the last point on that slide. It's still, when we're going back to talking about what's not abuse, what about the conversation or the concept of facilitating or allowing a person to be engaged in sexual interactions if they're a client, even if the other person isn't a client? Is that abuse? The answer is no if we can tick two boxes. First, you have to be able to say that both people have consented. Now, consent doesn't require a form to be filled out or even for a person to verbally consent. For example, if you have had a boyfriend or a girlfriend, you can tell that when you hold the person's hand that they're consenting to it because they're holding your hand back. If they're pulling their hand away and you keep doing it, then you don't have consent. So we can sometimes see consent non-verbally by looking at a person's behavior and seeing evidence of them taking the first step or of them reciprocating. So consent isn't only possible by people who are verbal or who can write and speak. It's also important to look at a second criteria. Neither of the people involved in the interaction can be a staff person or a person in any authority. And if that happens, then condition number one does not change it. In other words, no staff person can ever have a sexual relationship with a client, even if they're no longer in that relationship. Let's say the staff person has quit or has retired. And it doesn't need to be a paid staff person. It can be anybody in a position of authority, such as a minister or a camp counselor or a volunteer coach. Anytime that relationship exists, there is no way for a consensual and legal relationship of a sexual nature to happen. Sometimes people wonder whether or not a person must be cognitively capable, have a demonstrated cognitive capacity if they're going to be engaged in sexual behavior. And the answer is no. I know there is a lot of sociosexual implications to sex. It isn't as simple as the physical interaction. But sex as a physical interaction is not a terribly complicated thing. A person can tell whether they're enjoying it or not without having to have it explained to them. And we, as non-disabled or non-mentally ill individuals, are entitled to go out and make terrible moral choices in our sexual lives if we want to. We can have affairs. We can have unprotected sex. We can have sex with people even if we know they're infected with a sexually transmitted infection. Those are still choices that we're allowed to make. And the law does not make any provision for testing us for our intellectual capacity before we get to make them. So that's the truth for any of the people we are dealing with as well, as long as, again, that person does not have undue influence from a person in a position of authority. Sexual contact between a client and a staff or volunteer, as I said, is always abuse, and nothing can change that, no amount of consent. In Canada, the age of consent is 16. It never used to be. I want you to visit the Department of Justice in Canada and take a look at what exceptions and conditions apply to this rule, and be prepared to talk about them in our next discussion.